Talk to us a bit about the basics of the structure of fascia then.
Well, the fascia is created by a cell called a fibroblast. So I guess similar to an osteoblast, where we see trabeculi being laid down, that's also happening in a fascial medium. The fascial structure is being created by the fibroblast, and the fibroblast is a cell with many tentacles, simply put, and quite fuzzy, a bit like my head. So it's got cilia all over it, and has something called a primary cilia, which is more of a stiffened structure, and they're direction sensitive. So the more we start to put regular movements through the body in particular directions, the fibroblasts will organize themselves along those particular directions. And then the fibroblasts are producing collagen, elastin, and reticulin. And they're also producing a fluid base for them to live in called ground substance, so glycoaminoglycans. And it has to borrow Tom Meyer's words, it's basically snot. It's got a kind of gooey, mucousy kind of quality to it. And that material, that wet stuff, can either have a lot of glide to it, or sometimes it can thicken and becomes a bit too sticky. What's recently understood now is that fibroblasts are interconnected. Every fibroblast connects to another, one way or the other. So what we have from head to foot and skin to depth is almost a unicellular web. So we could say that within the fascial network is another connected network of cells, and they are all feeling stresses and strains and so on. So the primary ingredients are the collagen, the elastin, reticulin within that fluidy network. And our primary protein for the human and animal kingdom as a vertebrate is collagen.
There's a bit of a chicken and egg thing going on here as well, though, isn't there? Because if a patient comes to me in clinic and I think hyperpressive training would be really useful for you because you're planning on getting pregnant, there's lots of complications. I've got no one to send her to who can apply that training unless she's prepared to travel to see you, which is a distance away. And
well, I do online training. So.
Right, good. Well, that's the answer to that question. But you can still, even through online training, there are a lot of people getting pregnant every year in the country. You can't deal with all of them, can you? And the number of trainers in the country is still fairly low?
Under 100.
Yeah. How long is the training for the trainers?
So we run a day training course.
Yeah.
And that gives them the basics, the foundations, and everything they're going to need really to improve pelvic floor symptoms or whatever it is they're working on with their patient. Yeah. There is a process of assessment with that, so we want people to go away from the course and do their assessments and gain their certification for their qualification. And we also have an online version of that as well, which obviously isn't a day course, it's much more, you do it when you've got time, really.
Yeah. I'm not trying at this stage to plug the course that you are running. 16th of September?
Yeah.
Yeah, I'm sorry, all right, I am giving you a plug. But I am very keen that we get anybody who is suitable to come on that course to try and spread the word about this, because I just think educating the population is a key part of our responsibilities as osteopaths and chiropractors. It's written down in the procedures. We're supposed to educate our patients about things like this. We're supposed to help them out. We're supposed to refer them to other professionals if it will help their overall healthcare. But as you say, there's so many people who don't know about this.
So moving on to our next slide, we're going to just talk a little bit then directly about that combination where clinicians can support their patients using mindfulness techniques in the musculoskeletal. We've particularly targeted this at obviously musculoskeletal therapy and mindfulness. How do you connect into that in terms of building that connection and mindfulness for MSK patients?
Yeah, there's a lot of ways that mindfulness can help both the patient and the clinician. And in particular, I think in building the relationship, because mindfulness really, helps you to be fully present in the moment with that patient, and it's going to work to its maximal effect if the patient is also being mindful that connection's there. Because if you, for example, if you're caught up in thoughts, maybe the last patient is still with you in your head, or problems that are going on that you're not thinking as clearly, that mindfulness can really help you be fully present with the patient and really see a clear picture. And also the patient kind of feels that presence and fully listened to, which I think is quite powerful, actually.
Totally so. I mean, it
Yeah.
is sometimes difficult, especially having a busy day, or as you said, the previous patient has actually pulled you into, we're going to talk about heart sink patients, but
Yes.
it's pulled your heartstrings or whatever, and actually made you really lose a little bit of track for the rest of your day.
Yes.
How long does it take to recover?
Yes.
Because I think that's quite important. And actually
Yeah.
in a busy practice, short lunch break, there's not much time to get over what's going on.
One of the biggest issues is that we sit. And when we sit, and I'm doing it right now, so, you know, sorry guys, is that my pelvis is dropping under just a little
Yes.
bit. So my sitting bone is closer to the back of the knee. So that the hamstring length is already shortened. And my weight of the back of, especially this leg, is against the chair. So that the fascial wrapping around the hamstring and between them, and where the hamstrings meet the adductor magnus, which they sit in a channel, all of that can densify. And the moment that densifies, if I then try to sit up or sort of stand up and go towards a forward bend, all of that tissue is stopping me from moving. And then I blame the hamstrings for it.
Yeah.
But keeping myself in this position is shortening the structure. So then I'm creating a imbalancing its tensional arrangement. So I might need to bring movement back to that.
So what's your answer then? Desks mounted in front of a treadmill, sit to stand desks, or
Yeah,
just get up
to
and...
stand desks, but you know, also can people get on the floor? Are they able to get on the floor, sit cross-legged? Sometimes if they're at home, can they sit at home with the legs crossed on the sofa rather than sitting, I mean, not many people sit the usual way on a sofa anyway, or sit on the floor with the back against the sofa but have the legs crossed. Learn to find that movement. A good friend and colleague of mine who's a Pilates teacher since the 1960s, she's a woman called Hannah Jones, and she's on, aside from her Pilates teaching, she studied with an American tracker who's now in his 80s, Tom Brown Jr., and he learned from the First Nations individuals, or what we would have called North American Indians.
Yeah.
She spent some time with the elders on the reservations, and they had noticed, the elders, that the youngsters can't keep up with the elders when the elders are running in the forests. And she said, well, why do you think that is? And they just said, chairs. And she said, why? She said, they don't squat and they don't sit cross-legged. If we sit cross-legged, there's no load on the hamstring. It doesn't compress it.
Are you like me though? I can only do it with one leg. I can't cross the other leg.
I can cross both legs or sit on the floor.
Right.
Yeah, that's because I teach yoga. I spend a lot of time doing that. I'm not necessarily a lotus person. I get to half lotus, but lotus requires a quality of movement at the hip. But that movement, you can get into sitting, standing and forward bending really quite quickly. And you haven't had to do a pre-stretch for any of that. It's already available to the system.
Yeah. So breath holds then.
Breath hold. So what we have to remember with this is we have this reflex that we want to activate. So there's three conscious things that the person needs to do, that Richard's going to do, and that is to exhale completely. And then when he's exhaled completely, he's going to hold his breath. And then when he's holding his breath, he's just going to release tension around the rib cage. So that's going to allow for that vacuum to happen.
So shall I pull my...
Yep.
So you can, hopefully you can see.
So those are the
how I can
only
see.
conscious things he's going to do. So he's going to do some rest breaths first. So this is the lateral breathing. And then on the third breath, he's going to exhale all the air out. And when he's got rid of it all, he's going to hold his breath. And that's the reflex. So he's not sucking his tummy in. He's not consciously contracting. This is kind of like resting tone. It's not working tone particularly.
I think that's to breathe.
So the interesting thing about that is that I haven't done one of those breaths probably several weeks. But it's once it's there, it's there. That reflex action is there. That involuntary response, and that's what we're looking for. However, one quite important thing here is that this is the hardest part for anybody to get, if you like. So I think that's because the nervous system, the muscular system, communication is often poor in people who can't get this vacuum to begin with. But what we know from research in Canada is that actually you can still get very good results without creating that vacuum.
Right.
Which is interesting. because that's the thing that the hyperpressors people in Spain talk mostly about is the vacuum, but actually you get good results without it.
Got a quick question from Ash. Before going to sleep, I encourage myself to bring to mind 5 things to be grateful of in that day.
Yes.
So that's a good, lovely thing to do, isn't it?
Very helpful and
Yeah.
neuroscience-backed
Yeah.
tool for well-being is regular gratitude.
Yeah. And also
practice
just
or
before you go to
journaling.
sleep, I mean, that's
Yeah.
really good because you're going to
Yeah.
sleep better if you think of 5 good things.
Yeah, there's a quick one I can share that I invite people to do is to note down their eggs. And the first one is something you've enjoyed in the day, something you're grateful for, something that's made you giggle, because we need to laugh. And the S is something that's given you a sense of satisfaction or mastery, which is really helpful for procrastination.
Ah,
So
okay.
there
So
you
when
go.
you feel like you've achieved something.
Yeah, but it's really, noticing that and
yeah.
writing it down, so it
Yeah.
really connects you with the feeling afterwards. Be it you've put off doing your tax return and
Well, your exercises for your remedial exercise you've
Yeah,
been given.
yeah.
Yeah, I think
So-
that's something, it's quite hard to motivate people, and that's sometimes finding a motivator.
Okay, so it'd be connecting them with the benefit and moving their attention towards the benefit.
Yeah.
So it's like with the mindfulness,
Yeah.
when you start to experience the benefits, you want to do it more.
And you want to do it more.
Yeah.
So you need to get that feeling coming fairly quickly
Yeah,
if you
get
can.
the focus away from the pain and
Yeah.
the difficulty to the benefit
Yeah.
afterwards.